Joash, who's a gynecologist who's joining us, a consultant obstetrics and gynecologist who works in Imperial College in London. Apart from being an obstetrician and gynecologist, she also has an interest in lifestyle medicine. So I'm sure that will be really welcome to those of you who are joining us today. And for those of you watching on Zoom, on Facebook, welcome as well. Please remember to put your questions in the chat because we'll field them to Karen at the end of the session. And if you're enjoying the sunshine and you're watching this on catch up, just send any questions you have to the Caribbean African Health Network. So without further ado, I'm going to hand over to Karen for a session on Polycystic Ovarian Syndrome and a bit of lifestyle medicine as well. Thank you.
Fantastic. So thank you so much for inviting me to come and share. I'm very passionate about health. I'm very passionate about lifestyle medicine and what we can do to really empower you. I'm just confirming that you can see my first set of slides and it seems nice to share. Yeah?
Yes, I can see it, Karen.
Fantastic. So as Ngozi's kindly introduced me, I am a consultant obstetrics and gynecology. So obviously the gynecology is the focus on reproductive health, and that's what we'll be talking about today with the topic of polycystic ovaries. I'm also a lifestyle medicine practitioner, very passionate about what we can do within our lifestyles that can empower us to own our own health and to improve and get better. I will also say that I've recently also launched a company which focuses on wellness as well, and you can reach me at those two handles, Twitter handles, which are at the bottom there. So when we talk about PCOS, we need to understand that it's a very common disorder. It affects 1 in 10 women. Between 10 to 15% are expected to have it. Half of these women, unfortunately, go undiagnosed. And we're talking about in the context of the general population, but we know when it comes to women of Black and brown origin, it's even worse. So the diagnosis is even less common in these women. We know that 50% of these women go on to develop type 2 diabetes. And I know that this is an American slide, but if you can see the cost to the healthcare system, let alone the cost to life and to the family, is really significant. There are a few sort of issues that I will bring out when it comes to PCOS, but it's to understand that it's complex. It's not as simple as thinking, okay, I've got ovaries with cysts on them. There are reproductive, metabolic, and psychological issues that arise from anybody who has PCOS. And you can see the common signs and symptoms, which I will, again, summarize throughout this talk. So we think polycystic ovaries, yeah, okay, so what? Why are there cysts? And people don't often understand that. They think the cysts are the things that are giving them problems or pain. But I want you to look at the bottom left of the slide, and you can see a uterus with a polycystic ovary on the right and a healthy ovary on the, polycystic ovary on the left, healthy ovary on the right. I'm thinking doctor speak, you see, because we normally talk opposite sides. And you can see again a lovely diagram that's showing really the little cysts that have developed within that ovary. But why does this actually happen? If you look at an ultrasound and we scan, and when you go and see the doctor, if they are to diagnose it, they should offer you a scan. And what we will see is these little tiny black markers, which are fluid-filled areas, which are the cysts that you saw in the previous diagram. So if you think about it, this doesn't necessarily cause pain. So people think sometimes it's a big cyst. It's different from a big separate cyst that causes pain. And it doesn't usually cause what we call torsion, which is twisting of the ovary, unless they have become very enlarged. So PCOS is not just about cysts, and that's the message I want to get across to you today. It's a metabolic disorder. It's a hormonal imbalance which is altered, which leads to these cysts in the ovaries. So this is a very scientific slide, so forgive me, I will summarize it in a bit more in the next slide that follows this. But what it's down to is the way that the hormones become a bit imbalanced and the feedback mechanisms stop working. So there's something called an insulin-like growth factor, which normally it works and interacts with the ovary to cause the release of the egg at the appropriate time. But in the condition of polycystic ovaries, this insulin-like growth factor essentially is too high, and it inhibits the ovulation or the egg release. So those little cysts that you see left behind are not cysts that are forming. They are areas where the eggs should have come out and released, but unfortunately they don't release because they're inhibited by that growth factor. And you can see that on that diagram, IGF-1 we call it. So this then leads to an effect on the ovary, which lowers the sort of what we call sex hormone binding globulin. And that sex hormone binding globulin is a protein that binds to your normal hormones and keeps them low. So therefore you get a rise of the estrogen. So when you get a rise of the estrogen, just imagine what it's like. It's a bit like taking the contraceptive pill. So it feeds back to the brain that you don't need to release any more eggs. So it releases the FSH is lowered, which is a follicle stimulating hormone. And the LH is also altered. So the eggs then don't get released. And it's a vicious cycle. It keeps going round. The ovaries then produce more androgens, which is like testosterone, which increases the hair growth. So women will complain of hair on their face, their stomach, their backs, and so forth. Then we get the estrogens also higher. They feed back to the brain, as I've said, to stop the brain releasing any more eggs. And then it becomes a further cycle of insulin resistance, as you can see all the links in that diagram I've shown. So the blood sugar levels become raised in women. So in summary, so I don't want to get too scientific, so it's easy for everybody to grasp it, we get this disordered hormonal balance. So what are the hormones that are affected? We get a high estrogen. So we know that high estrogen promotes the lining of the womb to grow. So remember that. We get what we call the high LH FSH ratio, which means that if the FSH is low and the LH is high, that is a high LH FSH ratio. The FSH is your little signal that then, if you think about it, pokes the ovary and says release the egg, but that's low, so therefore it doesn't release the egg. We get high androgens because of what's left behind and what the ovary produces and what some of the hormones are converted to, excess hair growth. We then get something called a high cortisol because of the feedback mechanism in that hormonal cycle I showed, a high insulin because it's linked to the cortisol levels, and we also get a low progesterone. Now, progesterone is important for the lining of the womb to thin. Remember, estrogen is important to thicken it. Progesterone is important to thin it. So if you've got ongoing high estrogen, you can get a high growth of the lining of the womb, and you can also get high prolactin because of the hormone imbalances. So what symptoms do we get? So we get acne and oily skin. That's the testosterone excess. With the excess hair growth on the body, face, abdomen, chest, back, or even sort of buttocks. We also get the thinning of the hair on the head, which is an androgen or male type baldness. Weight changes and difficulty in losing weight due to that rise in that cortisol hormone you remember me mentioning on the last slide. And then you can also get irregular, prolonged, or no period. So remember what I said about the eggs not being released. That's when people don't get any periods. And the irregular periods, again, when the eggs don't get released in some cycles and some they do. The prolonged periods are to do with the estrogen being high. Remember we said the thickening of the lining of the womb with no progesterone. So what happens is you can get disordered bleeding and painful periods as well because they become very heavy. And then if you have not released the eggs, sometimes people get difficulty in conceiving or infertility. You can get to tiredness because of the hormone imbalances, and particularly around cortisol, mood changes with cortisol, which can be a bit sort of depression type symptoms or anxiety, and the bloating just due to the problems again in the hormonal and the truncal, what we call tummy laying down of weight and obesity. So what are the risks? So again, now I've shown you it's a metabolic disorder. It's not just simply about looking at cysts. We need to think about what are the risks. So if you think about those hormones remaining disordered, what does it cause in some women in later in life, I should say? It increases the risk of diabetes. So therefore women need to be checked regularly for that. Increases the risk of pregnancy diabetes, which is called gestational diabetes. So that anybody with PCOS should be checked early in the pregnancy and again later on in the pregnancy for gestational diabetes. The risk of cardiovascular problems, including raised blood pressure. Remember what we talked about with the cortisol levels. That switches on your stress system and causes problems with the blood pressure. Risk of obstructive sleep apnea, and that's not just related to weight, people think. It is also related perhaps to the rise in testosterone as well. And then the risk of high cholesterol or lipids. Again, that's related to the hormone imbalances around cortisol. This can then cause fertility problems, which we've talked about in terms of no eggs being released, and unfortunately miscarriage due to the metabolic disturbance or imbalance. It then can also increase the risk of endometrial cancer, which I've mentioned because of the progesterone estrogen imbalance and the psychological effects on people as well, again because of the cortisol. So if we think about the womb lining, just to summarize, because I want people to really understand and to remember, this is due to egg not being released. This is caused by an insulin-like growth factor, which affects the ovulation, which is normally important in the balance of hormones. The lining of the womb needs progesterone to prevent overgrowth. Remember that, because that's sometimes why people use treatments of progesterone for PCOS. And the progesterone usually only comes once an egg is released. So therefore, it's not produced in enough amounts. It leads to overgrowth of the lining of the womb, can lead to a condition called endometrial hyperplasia and also polyps, and can lead to endometrial cancer. So if somebody has a diagnosis of PCOS, it's important they must bleed every 3 months. So remember that. And if they don't bleed naturally, a doctor needs to give them medicines to help them to bleed every 3 months. Again, if the endometrial lining is thicker than around 7 millimeters in some people, they should need a scan every 6 to 12 months if the bleeding is abnormal, or every 3 months if no bleeding. And that's what you would see on a scan. So again, to show you with a normal line of the womb on the left, it becomes thickened with that red area you can see on the right. And if it's allowed to overgrow, it can lead to cancer. So how do we diagnose PCOS? So it's basically 2 of these 3 I put on. So you can either buy an ultrasound scan, which is why I mentioned at the beginning, women need to have an ultrasound scan, not just a pelvic examination, not just a speculum. They need an ultrasound scan, so you can request one from your doctor. They can also, we can pick this up on basically on history. So if you look at irregular, altered periods, as we've mentioned before, so the cycle more than 35 days in some people, or no periods for 6 months. And then if we're looking at clinical or signs or biochemical signs of high testosterone levels or hirsutism or acne, so that needs a blood test. So it's not good enough to go to your doctor and they send you away without actually giving you either a scan or a blood test, because they won't know, because PCOS is different for everyone. Different categories. Some people are slim, some people have excess weight, some people have hair loss, some people have excess growth, some people have facial hair. We are all different. It manifests differently according to which part of that metabolic pathway is enhanced. So some people it can be a high testosterone, some people it can be a low FSH. And so this is a summary of the investigations you should have when you go. An ultrasound scan, hormone profile with a lipid profile, an HbA1c, which tests whether or not you may have a predisposition to diabetes or sugar disorder, and thyroid profile as well. Your blood pressure should be checked, as I mentioned, because of the way in which it can affect your cardiovascular system. The urine should be dipped to look for sugar, and you should be offered ovulation tests as well, which are normally blood tests done at certain times of your cycle. So what are the treatments? So the treatments include the combined pill, which is essentially really mimicking to make sure that the lining of the womb bleeds every month. And you take that pill and have a 7-day break. Also progesterone pills as well, as I mentioned before, to keep that lining of the womb thin so it doesn't overgrow and reduce the risk of cancer. You should be advised about topical hair removal methods as well. And you can be referred under the NHS for this as well, and for laser treatment with a dermatologist. So don't feel that you have to pay for it yourself. You should be offered counselling or psychological support because of the hormonal effects on mood, and strategies to really ensure that your lifestyle is enhanced, but this is often inadequate. People will just say, go away and lose weight, and it's not as simple as that. Sometimes that cortisol makes the body hold on to that extra weight, and it's really hard for people to lose weight. So that should not be seen as a marker of treatment or a reason why you have ongoing PCOS problems. But you can have treatment that is over and beyond this. Surgical apnea support as well. Sleep apnea support. So you can be given things to ensure that you're not dropping your oxygen levels during the night because of the extra testosterone causing snoring. Sometimes it's not simply snoring, it's a change in the airway. And sometimes people can have supportive breathing equipment to help prevent problems from this. Surgical treatment should be last, and that's ovarian drilling. Before that, the other pills, which I haven't put on here, include metformin, which is a sort of medicine which can be used for diabetes, but can also be used to essentially support and reduce that insulin resistance so that the hormones return back to normal. Also, you should be offered fertility support. If you are not pregnant within 6 months of trying with PCOS, do not allow your GP to fob you off and send you away. If you've got children, let them know this. They should be providing support for you to achieve your baby. So PCOS is a condition where it's, if anything, the fertility treatments that now exist often work well. Sorry for that slide. Actually thought I had to remove that, but it's essentially just saying that polycystic ovarian syndrome is a long-term health problem. So now we come on to, are there racial variations? So this has been very topical of recently. And even myself as a doctor, I was very surprised to find out a lot of the research that we're told about, which relates to health, a lot of the time they do not have Black and brown people within those spaces to be able to statistically tell you what your differences are for your health in terms of treatment options and outcomes. And recently a study was done with PCOS and Black women, which recognized they were a higher risk of cardiovascular disease, high rates of metabolic syndrome, increased rates of excess hair growth, and also lower rates of diagnosis, for which none of us are surprised. So you can find this study on patientcareonline.com, but they did 11 studies of 2,800 women, where they recognized, if you looked at all the parameters, they had higher fasting insulin levels despite the same blood sugar level, which is the insulin resistance. The systolic blood pressure was higher. But then when you're looking at the endpoints of cardiovascular disease and problems, they needed more studies. They just did not have the information. But we know that actually, I strongly believe no matter what health issue that faces you, information and education is power. When we look at the Black population, you should all be aware, and I'm sure that it's been brought up in the talks before, about the concept of biological weathering, the understanding of the personal impact of racism, which is physical. It can be delayed, and we're talking about in the context of chronic illness. It can be immediate in the terms of chronic illness as well. Mental issues, performance related in relationships and at work, confidence, potential loss to the workplace and to society, trauma, delayed trauma because of what happens, grief, and differential attainment in any particular area. And that's also in the context of health. What we do know is that what can occur because of the trauma and the effects with the biological weathering is something we call epigenetic transfer, where it's a transgenerational shift. When you look at genetic modifications that are linked to PCOS, it's not saying actually your genes are wrong, but what do you bathe your body in will switch on genes which are pro-life or genes which are disease-inducing. And it's important for us to recognize this as a group and as a society, that we can adapt it, even in the context of still living in what we enjoy in terms of our cultural food and practices. But if you look at what we call the epigenetic signature, you can see the stress exposure, the social context, cumulative life stressors lead to an adaptation called an allostatic load, which increases your risk of stroke, endothelial dysfunction, atherosclerosis, inflammatory, psychological, and behavioral effects. How do we change this? So Professor David Williams, I'd encourage you to look at a King's Fund blog. It's a great blog that they've got there, which essentially is looking at the impacts of racism. They do lots of health topics, but they've got a particular blog on racism, which is great. And he talks about the biological weathering in terms of what I've just said. Remember, the epigenetics, repeated exposure to psychological stressors within our social environment, which leads to an altered metabolism. So although nobody's put it together, particularly if you look at the PCOS, they've just put that data and analyzed it. I'm giving you a mechanism to understand why women are at increased risk of PCOS risk factors. It's because the metabolic syndrome aligns. The metabolic syndrome that you see in PCOS aligns with what Black and brown communities experience every day. So we then have these effects, which we think are initially psychological. So you can see the mental health impacts, but there are also physical health impacts, and they both interconnect. So we see the physical impacts of an increased stress response, increased allostatic load, which I talked about before. You saw the cardiovascular effects, the rise in adrenaline, which makes your blood pressure higher. It makes sense, you know, it's a very simple fact, a rise in cortisol, which increases weight gain, insulin resistance. It's directly linked into a rise in lipids within the blood. That's the disordered cholesterol metabolism, which will then affect your cardiovascular health, and a rise in systolic blood pressure. And that's a chronic long-term effect, and that's been well proven. And then you've got the mental health effects as well. So you see, again, that links into how the stress response is triggered. So the depression, anxiety, and the body image can occur in PCOS, then makes people feel more isolated, the difficulty in adjusting to what's happened, causes psychological distress, the facility concerns need to neuroscientific changes within the brain, which we can see. We can see there's a height in what we call sympathetic flight or fight response, and the parasympathetic nervous system is reduced. So how can we empower ourselves to switch that on? I'm just very much, I talk about this woman, her name is Dr. Geranimus, I think I've got it probably a bit wrong, but she lived in America, and she saw pregnant young Black women coming in every day with high risks of disease. And as often people do, they put it down to Black communities have poor ownership of health. They're not great at exercise and blah, 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 and we eat really badly. She thought it's more than that. And so she did some studies to actually look at these, because actually, if you consider they're young, even if they've got some lifestyle factors, they shouldn't really be exhibiting things like blood pressure problems, insulin resistance at such a young age. But what she recognized that they had a stress response to whether or not it's within the society which they lived in, raised cortisol, raised blood pressure, altered glucose homeostasis, which leads to weight retention. So cortisol leads to weight retention. And then the cycle continues, raised blood pressure, raised cortisol, raised estrogen, if you've got higher weight, effect on the endometrial lining, effect on the ovaries, and it leads to body changes, so stress hormones. And these are the markers that she found. And I highlighted the markers that she found and linked them in with what we've seen in PCOS. So we've got the systolic blood pressure, diastolic blood pressure, the body mass index, the glycated hemoglobin, triglycerides, and the total cholesterol. So they all fit exactly with what we see. The studies are now telling us about PCOS in Black communities. And this is from obviously work that I've seen from the sort of pregnancy perspective. I don't think anybody's presented in this fashion before. So you're one of the first people that have started to understand this. But so if you see that perceived stress really leads to our individual differences, and then obviously we will have all slightly different responses. We'll have behavioral responses, flight or flight, according to the trauma and abuse that we experience. And it will affect how we have that physiological response as individuals. So what's the solution to this? So I know I've talked to you a bit about medical interventions, but again, I very much feel that lifestyle changes and a lifestyle medicine practitioner can make a difference. So I'm going to talk through these 4 areas just very quickly as we come towards the end of the talk, because I know it's about half an hour, so give me another sort of 5 minutes. So exercise. So one thing I will say in the top right-hand side, don't exercise like a man, because women have been taught to exercise like men. A lot of the studies when it comes to exercise are all down to male metabolism. And we haven't updated ourselves. You know, I'm somebody who's a lady of older age who's reached this stage where, all my hormones are switching off. And so I had to do a lot of personal research and to find out why I was putting on weight. I put on quite a lot of weight in the last couple of years. And, initially, always the big thing that you want to do is actually start exercising more. But exercise in itself is a stressor if it's done too much. And people often don't recognize that. So if you over-exercise, you switch on the stress hormones we were talking about, the cortisol, and then you still have the weight problem. So when you see some people thinking, actually, you need to go for a long jog, that's not necessarily what you need to do. You need to exercise to the point, yes, that your heart rate needs to be raised. It doesn't need to be too long. 10 minutes is probably enough, but low impact HIIT, that's high intensity exercise, can be very, very powerful. So even simply just standing on the spot and doing gentle squats to the limits of what your knees will allow. I would say that my knees were very creaky until I started doing all this. So I thought my knees would limit me. You do it to the limits of your pain and not beyond that. And gradually your muscle strength builds up. So muscle is really important because muscle helps to modify your metabolism. So in PCOS, it's really, really important because if you get cortisol raised, you get muscle wastage. You're more prone to lose muscle. So therefore, strengthening the exercise, and we're talking about light weights, squats, do 10 squats a day. And if you can't, just start with just gently moving your leg back and forth. but I use an app called Ptos. It's been really, really good for me. And it's completely free. You can put into it what you want to do. You can ask for low impact. You can do Pilates, again, which is a really good method of just increasing your muscle slowly. The important thing is that you give yourself a year to see the changes. It's not immediate. When it comes to weight changes, what you'll see often is a graph like this. It goes up, down, up, down, up, down, and then slowly it comes up, down all the way. So you will see weight gains from day to day related to fluid retention, which can change from day to day according to how much you've consumed. And it's something that you need to be aware of so that it doesn't put you off. But daily weighing is felt to be helpful if you're looking at trying to modify your overall weight. But remember that muscle weighs more, but definitely don't use that as a reason not to lose weight. Now, the other thing is really important when you're thinking about exercise, stretch routine. So stretching activates that parasympathetic system and switches off the stress system, so allostatic load. So for those of us who are starting off with exercise, you don't need to start jumping around or doing anything. You can start off with gentle stretches, simply even just lifting your arm up like that and stretching and holding it for 1 minute just reduces the stress load on the body. And that's really important, to reduce the stress loads and switch off that cortisol, reduce the insulin. And then walking is important. So a half an hour walk, 20-minute walk, do what you can do, even walking up the stairs. So if you're at work, walk up 2 flights of stairs and then get the lift the rest of the way. I started to do that. So there's 7 flights of stairs now at my work, and now I can walk it up it. But first of all, I used to get to the top and I'll just be breathless at the top of the stairs. And so those are a few exercise tips. Now, diet. So I've got a few things that I could talk about diet forever, because again, I've done a lot of research into looking at diet. As much as I love my medicine, I should say I'm also a biochemist. That's my first degree. I've done that master's level into medical biochemistry. So the metabolism really, I find really exciting. So do not starve yourself or do excessive dieting. This switches off your metabolism, and we all know it. So what happens is that when you stop eating or reduce your diet dramatically, your metabolism does the same, because it's essentially you go into starvation mode and your metabolism is so clever. It's like, I need to hold on to more of this food. And so what happens, it just holds on to more and more and more. So do not starve yourself and don't do excessive diets. But I think diet modification is the way forward. So think about portion reduction. So, I'm, of Ghanaian origin. I love my rice. I love my white rice, my jollof. I would have it heaped up on the plate. So rather than have it heaped up on the plate, just cut that down by a spoon at a time. Till now, it's probably less than a quarter of my plate if I'm having rice. And so portion reduction, that's one tip. Carb cycling is another tip. So again, some people like keto, and it's very good for those with type 2 diabetes. There is some studies to show that some people, if they do keto but rebound back and go on to carbs, actually that carb metabolism becomes worse. So if you feel that you're somebody who will not be able to live without carbs for a lifetime, I suggest either carb reduction or what we call carb cycling. So you have days where you don't have carbs, but you have days where you do. So like on the weekend, for example, you will eat carbs as you want. I love my bread, but I try and make my bread healthier. So eat sourdough bread, which is high in probiotics, really good for the gut, or brown bread as well. Don't necessarily get it from Tesco's or Sainsbury's, but try and find some of these bakeries that make the really lovely fresh bread. We know that traditional sort of African and Caribbean type breads are very dense and very high in white flour, which are also not good for carbs and sugar levels. So the other thing that some people do is intermittent fasting. So again, I use that. So I know that in the morning, for example, I'll have a cup of tea. I've just had my tea here, and I'll put in some collagen powder into it, which is protein mixed. And that protein, which I'll tell you about a bit later because I've started the company, will have vitamin D in it, which is really good for your bones and your serotonin. And then that also helps with your lowering your cortisol and then also insulin. And then I've got vitamin C in that as well. And I have that, and I know then I won't necessarily eat, I'll have lunch and then I'll have dinner. And in that, I've been able to also modify my weight. So the protein, as I've said with the collagen, is really important, and it's very important in muscle maintenance. The more your muscle goes down, the slower your metabolism becomes. And it can be simply as, if you can't jump up and around, you can have a weight in your hand and decide you just do weights with your hands as you sit, maintain the muscles in your arms. And as you do that, the muscles in your chest increase. That increases your basal metabolic rate. Then think of foods that are rich in antioxidants like vitamin C and berries. These counteract the stress response and help your adrenals to respond to stress responses as well. Avoid high sugar diets. So again, you know, extremes of sugar. I'm not saying I don't take sugar in my tea, and I've gradually helped my children not to do that as well, because it helps, it makes your insulin shoot up really, really high, and then affects the insulin resistance. Understand the calories in food. So a lot of us don't understand. So therefore we think, I'm not eating that much. But for example, I had a friend which in the morning she had 2 slices of toast, she had a sandwich in the afternoon, and then she had something like with pasta. But what she didn't realize is that in the sandwich it had about 600 calories. So even if she had had some sweet potato with chicken, like 2 portions of chicken and some vegetables for lunch, that would have been better for her metabolism than that white sandwich, which she thought was okay. So it's really, and then also understanding your fruits. Sometimes we think fruits and vegetables are great. Vegetables, you can eat loads and loads, pile up your plate with that, but don't add too much in terms of honey or other things to make it sweet. But then there are some we know aren't as great. So like, for example, plantain is not as great. If you look at what's in plantain crisps, or it's a lot. So roasted plantain can sometimes be a bit better. And then green plantain we know is also very good, doesn't affect your sugar levels. And then low glycemic fruits such as berries, pears, plums, they hardly contain any calories, but bananas got loads in it. It's a bit like the plantain. So if you want the banana, have it every so often, but not very often. And then incorporate your superfoods into your food. We already have them culturally. We have a lot of fantastic things that we take. Ginger, turmeric, and these are evidence-based. It's in there. The science is there that we know in high amounts they can help fight inflammation of the gut, which then affects the bacteria, affects your probiotic load, which I'll go on to talk about, and also your sugar load. And then consider nutrient-dense food like soups. So we're great at making wonderful soups. And you can have your lovely soup with lots of chicken in it, a few bits of potato in there. Having that for lunch or for a dinner will keep you lovely and full and very good for your metabolism. And then the healthy fats I've mentioned there. Fats are very important. Don't stop fats completely. There are some healthy fats that are really important for your metabolism. So in terms of supplements, because I know we love our lifestyle medicine, and this is particularly in the context of PCOS. So probiotics are really important in gut health. I mentioned that before. They regulate immunity. And there's so much research that's coming out in the last 3 years. If you, for example, probiotics, if you have that in the context of somebody who's had a vaccination, like COVID or flu, your immune response is better. Your antibody levels remain higher. I take probiotics. They're really, really good. I notice the difference if I stop taking it in terms of how I feel, my energy levels, food hunger signals, and so forth. So I would encourage you to take them. A good brand is Biochemical or Optibac, and it can be a really, really good investment for you. Magnesium, really important in muscle function as well, and also in sleep. So sleep is really important for people who have got PCOS to reduce those stress levels. Important to take it before bed, but it has to be in the right amounts by about 400 milligrams. And then beetroot, very high in nitrates and good for maintaining glucose levels. I'll try and hurry up. And then the other things I particularly tell my PCOS ladies to take is myo-inositol. It improves ovulation, and it's been shown in fertility studies, even in IVF, to improve conception rates and the quality of eggs. Chromium as well is shown to increase fertility by modifying sugar levels. So anybody, for example, my women that are pregnant, that have got diabetes, I put them on chromium. And then collagen, again, really important. It's a healthy gut lining, can reduce hunger levels, helps maintain muscle, joint health, immune system, skin generation, and acne reduction. Omega-3 is also really important, your fish oils, and reducing inflammation. And the other thing I want to introduce you to is something called seed cycling. So this is a way of using the seeds to mimic, remember the estrogen progesterone I talked about, which are disordered? So the first part is making sure you've got the flaxseed and pumpkin seeds, and they help your estrogen levels. And then the last second part, the day 15 to 28, help your progesterone levels. And some people actually see their periods come back just using seed cycling alone. So relaxation, really, really important. So sleep, I mentioned briefly just before, magnesium is really good as a sleep-induced agent. Alcohol is not. Alcohol will put you to sleep quicker, but you won't have a deep sleep. You almost lose that deep phase of sleep. So really important to recognize that and modify your alcohol intake. Mindfulness is just a breathing practice where you reduce that stress symptom and bring it down, stress system, and bring down to a calming relaxation system. And there are lots of apps and free apps that you can use. They can be found on spiritual apps as well, as part of your meditation when you're practicing that, which is also really, really important in this as well. Progressive muscle relaxation is another method of reducing the stress response and is available for all of us to use. The stretching I mentioned before, massage, and the massage is because of the touch. The touch on the skin basically activates the parasympathetic, which is the calming nervous system. So I've got something, my family are Gar, they use something called kocha, which is like the loofah. So if you're in the shower and you rub it on your skin, or even if you're using a body scrub, you know, you feel that sense of, oh, it feels really relaxing. That's what it's doing. It's switching on that parasympathetic nervous system, as well as really, really healthy for skin as well. Having fun, go out, you know, have a social life, reach out to people. Socialization is a really, really important part of life and living life well. I could talk about all this forever. Gratitude journaling, positive affirmations, really important to think about what are those, you know, 3 things that you can be thankful for in your life every day before you go to bed or when you wake up. And you can journal and write this down as well. Now that's been shown to switch off the stress response in the brain and switch on the positive response. So, you know, when I talked about neuroscience and things changing within the brain, you have the power to change it back again. So it doesn't mean glass half full, always a glass half full. You can literally transform, and these have been seen on MRI studies. I also like reflexology, and that's a practice of foot massage to reduce tension and stress, and also enhance sleep as well. Resources I want to signpost you to include the RCOG, which is the Royal College of Obstetricians and Gynecologists, and you can get patient information on PCOS there. There's also the She Sinks PCOS network. Is a fantastic resource which I looked at when I was doing this talk, and it's really good. It's by a group of American doctors, which also they've also lifestyle medicine practitioners. So it's got a lot on lifestyle. You do have to pay a small amount. Sorry, that's my Apple Watch. You do have to pay a small amount, about £30 to join it, but it's got all and beyond the resources I've talked about in terms of lifestyle. They talk particularly about what sort of symptoms you have, whether you're androgen specific, and what sort of foods that you can take to guard against that, and vice versa if you're more insulin resistant, for example. And we don't have enough time to delve into that today. And then there's a NutriTank. Again, I'm a member of them, and I teach medical students about health and pregnancy. They're a really good resource to follow on Instagram because they come up with lots of different topics, not just related to this, but men's health, women's health. I encourage you to follow them. NHS websites, which aren't always so good. Wellness hubs, definitely look into that for what lifestyle changes, and the Fit On app I mentioned before. So that's just my website for obstetrics and gynecology. I come to the end, and those are a few of the handles that I'm part of. And then if you want to buy some collagen type products, which I mentioned, I make a superfood collagen range, which we've only just launched
good position, not just
in the last week. Sorry, somebody's going off mute. We only just launched that in the last week. But if you go to the wellness section, you'll be able to order some of the collagen superfoods, which I'm really passionate about. So I'm going to stop sharing there now and say thank you.
Thank you so much. Thank you. That was excellent. I think that although you came to talk about PCOS, team, can you take that? Can you stop sharing your slides, Karen?
Okay, fantastic.
Although you've come to talk about PCOS, the lifestyle section of this was fantastic. And I almost wish we'd asked you to do one session on PCOS and another session on lifestyle, because the lifestyle was absolutely amazing. I think for every session we have questions about lifestyle, and what you've talked about is I think is instructive for all our sessions that we've had. So thank you so much. As you said, these sessions are for information and education so that we can empower ourselves to look after ourselves better. So this was fantastic. There are lots of questions. I'm going to try and group them together. Some of them on lifestyle, because people want to know a little bit more about that. Well, a lot more actually. And so what we tend to do is, for anybody watching, we tend to have you can watch this again That's the first thing to say. On a section of our website, of the Caribbean African Health Network website, there are additional resources to all our sessions, and they've asked whether you can share your slides, and we usually put that in the section of the website. The third thing I was going to ask quickly before I forget is your Twitter handles. So I've seen that one is at Miss Karen
Joash, yeah, so that's that yes, that's that Miss Karen Joash, that's my Twitter handle. And then Instagram is probably a bit better for the lifestyle medicine, it's Pura Vita, but we've only just started recently, so there's not many posts, but there are a few posts up there. But we're really sort of passionate. I think it's just, you know, for me as a doctor, I sit there and I've realized, you know, I'm being a doctor now, and you're the same in Ngozi for about 20 years, and we focus so much on dishing out tablets all the time. But what can we actually, you know, sometimes do to actually empower people to reverse some of those effects of chronic illness? And I think maybe also using myself as a little bit of what shall I say, experiment on myself.
Yes.
So going through the menopause and just thinking, okay, what's happening? I had all my colleagues saying, I know we're talking about PCOS now, say, well, just take HRT, just take HRT. And I know it's you know, it's fine, we can take HRT if you want, but I just wanted to try and find other ways to modify my, you know, my stomach was getting bigger, you know, I was feeling more unwell, very tired, sleeping, hot flushes were just out of the roof. And because of my biochemical background, I always know, I think that, you know, we can't produce chemicals, we take things out of nature, you know, and we kind of modify it to what we think works best. So for example, beetroot is high in nitrates, but you have to take it in high enough dose. The research shows you have to have high dose beetroot at about 1,000 milligrams a day. It lowers blood pressure. So for the people who've got high blood pressure here, if they take that as an adjunct as well with their blood pressure medication, it's less likely they will need two agents. It also, because of the nitrates, increases the blood flow to the organs, maintains the muscle strength, it lowers the blood sugar level, and reduces ongoing cardiovascular problems, which may occur in later life. I mean, that's really important for people to know. You know, and if you look at pomegranate as well, again, it's the high dose pomegranate, which we know has got antioxidant effects. They've used that in cancer studies. We know it reduces the risk of cancer and prostate cancer in men, for example, but we don't talk about that enough. And we know, again, it reduces blood pressure. So it's just simple things like that along the way, you know, and even we've got things in our culture that we know that we use. And the reason for that is because, you know, clinical medicine is less well developed in some of the cultures that we're from. So people have had to find things as adjuncts. But what's happened is that people haven't then used that to then take the next stepping stone and link the two together. So for example, collagen is found in bones and bone broth. So the soups that we used to make, so for example, when women are pregnant and they're recovering, you give that to them to recover. Because it's so high density, produces, you know, 70% of that network we need for our pelvic floor. In menopause, we're talking about just doing exercises, but we haven't got the building blocks. And then collagen again modifies that gut lining. So the gut lining heals, our immunity is stronger, and we're better. And then even some of the fermented foods that we have, like kenke. I don't know if anybody here is Ghanaian.
Yeah, I'm not Ghanaian, but I know kenke.
Yeah, so that's, and there are other fermented foods that we have in different cultures. So that's probiotic strong, you see. So that's really good for the gut lining, and then also for sugar metabolism. And then other cultures use things like kefir as well, which is really high in probiotics and really, really important. And the studies are all there. So I can talk forever on this. I'll probably let you
I can tell. I'll go through some of the questions, but just before we start, so one of the things you started off by saying was that it was more prevalent in Black women. Is that because all these things that you've mentioned, some of these lifestyle choices are things that women who live in Ghana and Nigeria and Africa are taking these supplements on a regular basis? Is the risk the same is it because we now live in a different culture and we've modified our food? Is it that they're just not used to the symptoms that we may have? Why is it more prevalent amongst Black women?
And so in terms of your question, you're talking about women in the UK, or is it
in the UK?
Or
is it just
so we've got an added, so we have an added factor. Everybody says it's complex, but the added factor is that we live in a stressful society. Sometimes we're so used to it that we blank it out. You know, sometimes, you know, I've had instances of racism that I just blank out because I'm just used to having racism all the time. But when you tell somebody about it, they're like, gosh, that's shocking. I go, I know, but you kind of internalize it, it's in you. So, you know, for example, when George Floyd happened, the rise within the incidence of anxiety and depression was huge because it also triggered in a lot of people the undiscussed instances of racism, because none of us want to be within a group where we know that we're more prone to have racist events. Who wants to be in that group? But it was a realization that you're not alone. It's actually happening to everybody. Oh my gosh, we're in this for life. So that impacts on us, and we don't talk about it because it's something that's
the internalization of this.
Yes,
gives you more stress.
Yes.
So in actual fact, we're more stressed. We're more prone to these things because we're not living in an environment where being black is just part of who you are. You don't
exactly. And you know that. So unfortunately, some people see you and me in GOSI and they think, oh, there's black doctors, there's no racism. But actually, we probably experience more racism than other people who live in black communities.
Yeah. Okay, so I'll go to some of the questions. Some of them are really just practical questions from people who have PCOS. Somebody is asking that if you cannot take the pill, is the only option surgical?
Definitely not. So I think I put all my women, to be honest, when I see them on myo-inositol, chromium, I think that makes a big difference. And there's something called MyOva. There's a product called MyOva, MYOVA, that includes that with folic acid. And there's MyOva Plus, and that makes a lot of difference. So some people see their metabolism start to shift, their ovaries come back to life, so to say. The important thing is getting your ovaries to come back and do what they're supposed to do by switching off those signals which are telling it not to release the egg. And that's by getting control of your metabolism. So those are some of the elements that work. I also tend to give my women metformin if I think they're particularly insulin resistant. So it's important to recognize that. And in some women, it takes time. You may have to increase it. It may take 6 months of use. Some people it will also work, and some people it won't. And then the other thing is really thinking about the protection, the lining the women, as I talked about, the progesterone. So giving them that hormone so that they then bleed. Again, that may then sometimes be a trigger because it may reset the hormonal lining again back to normal. So there's definitely also lifestyle changes. So also sleep and de-stressing, I would say, is a big, big factor. So if we think about the socioeconomic issues of race, we know we're less likely to get good jobs. We're having to prove ourselves more in the workplace. Therefore, it becomes a more of a stressful environment. You know, I saw a fantastic video recently by the Creative Society where essentially they showed somebody going around to the office, a black guy in the white office. And every time somebody did something to him, you saw a cut on happen on his arm, but he was just still smiling and talking. And at the end of the day, he went to the toilet, lifted up his top, and he had all these scars on. And then he went to go and then see the cleaner in the office, handed the cleaner something. The cleaner put his hand out and his arm was covered in scars. And I think that's one thing we don't do enough as black communities. We have to learn to take care by relaxation. And that's one of the first steps. And then your body can start to respond because the stress levels come down.
Yeah. There's another question here about the effect of menopause on PCOS, because all this is hormonal. And with all the hormonal changes with menopause, how does that impact on your PCOS?
So it can send it all completely haywire, to be honest with you. And that I would say definitely needs somebody, obviously to be seen or take better care. But the lifestyle changes I talked about are still really, really useful. For example, sometimes we do have to do a lot of dietary modification. It's not easy because we all like certain things which taste nice. But the way I get around it is definitely by having sometimes those weekend treats, but not too much weekend treats. And gradually over time, you get used to it. It was almost talking about having a psychological difference with food and visualize what that food is sometimes doing to your body. And I think that can be helpful for you to reset how you do that food. And there are foods that you can enjoy, but the lifestyle measures about really ensuring that you have that relaxing thing. You think a massage isn't much, but it can make a big difference. I work very hard. I'm sure you work very hard in GOSI. And people say, how do you keep going? Or how do you look like how you do? But I have a lot of self-care in my routine. And it can be simply like sitting in the bath for like 20 minutes.
Yeah.
It doesn't have to be something that's expensive. And I factor in walking a lot as well. So walking has really good metabolic effects, increases muscle mass, reduces fat loss, but also psychological effects, reduces the stress response just because of that interaction with nature outside as well.
And the journaling, I do that.
Oh, thank you. I was just seeing Amy's put something about MyOva. It changed her life and she fell pregnant. So yeah, and Amy, thank you for putting that, because these are things that we think it's all about medicine. It's not. Really, really important to know.
Okay, there's another question here about there's someone who says that they were diagnosed with PCOS a few months ago. But why she's really worried now is that she's stopped bleeding since the middle of January.
Okay. So first
she's
of all,
been
don't worry.
She's been bleeding non-stop, and she's now anemic, and she's on metformin, and they gave her some pills to control the bleeding, but the bleeding's not stopping. So
Yeah.
it just seems a bit complex.
So she needs to see a gynecologist, and that she should have the line of the womb checked. And it's unlikely that there's anything serious, to be honest with you. I do a lot of menstrual disorders and do a lot of hysteroscopies and biopsies, and very rarely do you find anything. But it's important that you see a gynecologist so that they can check the line in the womb and do an endometrial sample if needed be. But you can still take those medicines we talked about, the myova, and still consider the seed cycling I talked about, because it changes your hormonal level naturally as well. Okay. And the collagen's really important for you as well, actually. Collagen and the probiotics, please try and have a look. Probiotics, Biochemical is really good. And collagen, if you can get hold of that, really, really good for the gut too.
What we'll do, we'll put some links in after this. We'll have this on the set, because I'm sure people have additional questions about where to get these things.
Yeah.
There's a question here about facial hair. I think that worries a lot of people with PCOS.
Yeah.
And can that be resolved without any treatment? Does that get better as you get older?
So again, it's about setting the hormones. So you remember I showed you that slide at the beginning with the testosterone and how it goes up. And also sometimes if you've got excess estrogen, it also then converts to testosterone. And estrogen occurs within the fat cells as well. So if you have more fat cells in your body, you get more estrogen. So we also see that at the time of menopause, you get more facial hair. So it's again, using some of the things I've talked about. I think the seed cycling is a really good start. It's thinking about different things that you can do that will lower the testosterone and the estrogen levels. The collagen is really good, particularly the superfood collagen, and general strength exercises. So again, when we're talking about exercise, people think you need to jump up and down, but simply starting off with weights. It seems odd. You can stand there and do lift up weights for 10 minutes and you can be sweating and your heart rate goes up.
Yeah. And
simply doing things like that can help to start to reset that estrogen level and the testosterone as well. People think it doesn't make sense because you're gaining more muscle, but women need more muscle. I think we've been sold a lie that you mustn't have muscle. And muscle is protective for our bones and for our future health and longevity. Really, really important.
Yeah, and when I got older, I got a pair of dumbbells, and during the when I'm watching TV, I sit there and I just hold them. It's pretty passive.
That's why she's got fantastic arms and goes, yeah, I love that. I've got some dumbbells and I'm gonna do that in front of the TV as well.
Yeah. So there's a question here about whilst we've had so many talks about outcomes for Black women in terms of fibroids, IVF, that the outcomes are much poorer when it comes to Black women. And I know the majority of the people who tune into this are women as well. So it was just general strategies. And I think you've covered this, but there was a specific question about general strategies to support and help women who are going through IVF, where they can sort of help themselves to get better outcomes, lifestyle choices for fibroids. Now we know the fibroid is a growth and you've got to sort it out, but things you can do. There are lots of things we've talked about today.
So when you're thinking about fibroids, one thing I will say in fertility, think about your immune health. So people think about immune health in the context of viruses and bacteria, but your immunity also modifies what grows in your body. So when you're thinking about the vagina, you'll think about there's something called the microbiome and the gut. And if that's right, and you've got the right, what we call acidity and pH, then that tends to promote fertility and that the way that the endometrial lining function is and the way that ovulation occurs. So probiotics is really, really key. And I think that's a message I tell all my pregnant women to take it, really important. I tell them from 2 weeks of age, your baby should be having it. And the reason is because our environment has changed so much in society in terms of antibiotics and so forth, that has affected a lot of things. So that's one big, big tip. The second is inflammation. So if you're thinking about the immune system, and particularly we see in the Black community a lot of inflammatory disorders. So lupus, for example, is an immune system dysfunction. Fibroids, I would say, in a sense, is an immune system change. It's the way in which signals, which are called cytokines, trigger that muscle layer of the womb to overgrow. And we know also with estrogen, it overgrows as well. So if we first of all look at the inflammation, how do we tackle that? So the probiotics, again, are important inflammation. Omega-3, really, really important. If you look at it, it reduces inflammation by 30%. A good high dose supplement can really, really change that and be a major factor. Things like turmeric, you can't take turmeric in pregnancy, and for the person who put about fibroids in pregnancy, but turmeric really, really good to reduce inflammation. And then the probiotics to put that to really help. Now, the reason why I come back again to collagen, and I'm really probably a bit upset that collagen has been taken over by the skin industry, is because collagen is also important for the gut lining. So remember, your healthy gut lining is the first line of defense of the body. Whatever chemicals come into the body then can trigger long-term effects in the rest of the body. Your gut lining is regenerated by collagen. So if you've got that healthy collagen intake, which a lot of us don't have because we just don't take enough, that helps your gut to reform. I'm an IBS sufferer. I've got fibroids. I had menorrhagia to the point of, you go to my sister's house, ruined her bed, the whole shebang, anemia. But I've modified that by, I've got a Moringa, I take probiotics, and the collagen has been a game changer. It's really helped my IBS symptoms and pain that I've had. So when you're thinking about fertility, I would say that probiotics, collagen, omega, just think about those things, and then the myova as well. The myo-inositol, really important sort of game changer.
So how will you talk about collagen? Are there collagen-containing foods, or is it collagen as a food supplement?
A food, so you can do both, but the problem is it doesn't contain enough to make a difference. So again, the collagen for PCOS is really important for example, the skin. When you get the acne, it helps with the skin to reform. So people think about skin, but just think of what it's doing all on the inside of your body before it gets to skin, because skin's the last thing to normally get the benefits of anything that we ingest. And so it really is as a food supplement. It needs to be taken at least 10 grams a day. You can take it when you're pregnant. If you go to Pure Mama, and it's with an R, not puremama.co.uk, that's the new website that we started from the 4th of March. So please support us, and we're selling collagen products on there as well.
Okay. Evening primrose oil.
So thank you very much. You can go, that again is really good as an anti-inflammatory agent in the context of PCOS, but again, it's the dosage. So oftentimes, I've looked into the supplement industry, and a lot of the time, the reason why it doesn't work is that general supplements, you will get them in your everyday diet. And in order to target your own health, you need to pick the ones that you feel that you need. So for example, me, I've got borderline blood pressure. I take higher dose beetroot supplements because I know I need those. I can't just take a multivitamin because it won't supply everything I need. So magnesium, so for example, I get headaches sometimes, that helps with my headaches as well. So a general multivitamin, well women, all that stuff, all well and good, but you really need to take targeted things which are in the right amounts. Most don't contain the right amounts unless you buy them individually.
I tell that because I got this app, MyFitnessPal.
Yeah.
And so I then saw how much away I was from the nutrition that I should be having, because they're just not there in what you eat in general.
Yeah.
So that was a real eye-opener for me.
Which app have you got? Which one did you say? What's it called?
MyFitnessPal. So it tells you all the different things out inside what you're eating. So it then tells you what you should have. Yeah. And just by eating normally without any supplements, you find that you're very far away from having enough iron, enough magnesium.
Yeah, definitely.
Which was a bit of a shock.
Yeah, it is.
I had a very healthy diet.
Yeah. And even that's why the vitamin D crisis has occurred. So, again, we all thought, well, what's happening? Vitamin D can't be real. But it is. We saw it in the babies. You're the pediatrician who was starting to get rickets.
Yeah.
And then we picked it up in the mums. And now we realise the whole population are deficient. And then people think it's just a vitamin. Oh, it doesn't matter. COVID hit. And now people realise how important it is. Vitamin D is the precursor for the lung immunity cells. It triggers them to help them fight viruses. It's a precursor for serotonin. And serotonin is made in the gut. If you don't have a healthy gut, the probiotics, you can't have a happy hormone. So that's why people low in vitamin D are more depressed. It works in your kidneys. So that's why people low in vitamin D and low blood, have high blood pressure. The list goes on forever. We can talk.
All very it's a well-honed machine that we have to look after our bodies, isn't it? Make sure everything's working in sync.
Yeah.
So the question here that someone's asked, don't we have to be cautious when we're taking blood thinners and blood pressure tablets and with sort of additional supplements?
It depends which ones you are. So I know like Agnus castus, and there's some other ones which you have to be cautious about. Agnus castus has got a lot of estrogen in it. So if you're thinking about, you don't want to be pro-clotting. But yeah, no, it's absolutely fine. I have pregnant women who are on aspirin, Clexane. They may be on blood pressure tablets. They have to take vitamin D. It's mandated. So we need to really understand exactly what your condition is. But as far as I'm aware, vitamin D is just part of food. So you shouldn't really be told not to take it. And if you're low, and particularly for us as black and brown people, that we just don't absorb it through the sun, because that's how we were made, because we're made to live in a very sunny climate and have sun exposure all the time. But we don't sunbathe. I definitely don't go and sit outside. We're sitting inside most of the time. But, you know, it's interesting. The other thing I'll say to add to this, you know, I do private work as well. And so then I have some clients who are like, for example, wives of Premier League footballers. So Premier League footballers, because they understand so much the nutrition and difference between performance, they get beetroot shots, high dose beetroot. They get vitamin D tablets given. They have all these shots of particular vitamins that they know enhance athletic performance. So for those of you who are athletes or who exercise, look at the difference between beetroot and exercise and the energy levels. It's a game changer. So, for example, my son, he does football. He's in America at university, and he used to get cramps on the field all the time, and it was always an issue. We're like, oh, what to do? He's got sickle cell trait. I also have sickle cell trait. Taking beetroot solved his cramps. He now takes high dose beetroot, and that was something that nobody knew how to solve for, you know, he's been playing football all his life for 10, 15 years. The minute he took that, it's completely changed. And it's just simple things like that we don't understand, because it's got nitrates, and it's like taking GTN, and Gozi will know what I mean. Yeah. So it just increases the blood flow to the muscles, so they don't get the cramps. So again, I think people who have sickle cell anemia should be on beetroot. But if you look at sickle cell anemia, their treatment is not about lifestyle or what can change or dietary modifications. It's all about giving them pain relief, and blood transfusions.
It is. Someone said that I don't particularly want more children, but I have an implant. Does that contribute to my PCOS and my weight gain?
It depends on what implant it is. It may be necessary, because remember, the line of the womb also needs to be kept thin. There have been some studies that show that some women over a period of a year may increase their weight gain on implants, but you'll need specific advice according to which implant you have in place.
Okay. Can you take collagen whilst you're pregnant?
Yes, you can. In fact, I recommend it to all my women. The evidence shows that it reduces miscarriage, because it's important in the placental formation. Collagen is placenta, you know, it's got collagen in it. The cervix, the womb, as it grows, needs collagen. Your joints, your ligaments, as they get stressed, they need the collagen. Your pelvic floor needs the collagen. Skin needs a collagen. And I don't tell many people this, but it helps prevent stretch marks too. But I focus more on the non-cosmetic effects of collagen. Yeah.
Someone said you've talked about quite a number of supplements. Can you take all of them, or do I need to be a bit more targeted?
You ideally targeted, but I think for general supplement use, I think for me, probiotics, vitamin D, the collagen that work well for everybody, and omega-3. And then you need to top on and put other things which are specific to your own health needs. And that's where we get it wrong, because we're trying to say one size fits all, and it doesn't. That's why multivitamin doesn't fit all. So, for example, even the vitamin that we develop for pregnancy, we know that women are commonly vitamin D deficient, iron deficient, and also they don't have choline. I haven't talked about choline today. So choline is a bit like folic acid. So if you know anybody that's pregnant, make sure they take choline. So we know that it has really good effects on baby's brain development, neural tube development. So we're recommended in America, but in the UK we're not doing it. Even the Americans fortify their formula milk with it. So we developed a supplement that's got choline in it, because we know 50 to 70% of women are deficient in the UK of choline. They don't have enough in their diet. So babies need it for brain development. And also we need it actually for women generally. It's actually also good at time of menopause for brain sort of processing, you know, all the memory bits that go a bit funny sometimes.
Very funny.
It's really
what does it mean when they say you have an overactive immune system?
So that's about the inflammation. Do you remember when we talked about it just a minute ago? So it's talking about, so the immune system works in two ways: to fight disease, but also sometimes it can be switched on too much. And that's actually what COVID was. A lot of people didn't realize. So people would get a week of the infection with the immune system fighting the sort of disease. And then the second week they would get, the body then starts fighting itself. The immune system gets over switched on. So anybody who has COVID, that's why in particular, take your probiotics. I up the vitamin D, vitamin C as an antioxidant, really good to help fight and reduce any overstimulation of the immune system, and the omega-3 as well.
Cervical polyps, somebody's having repeated polyps.
So just think about your estrogen load then. So just think about, so we've got, you know, for example, if you look at traditional cultural foods, yam is very high in estrogen, which is why there are higher incidence of twins in African cultures. Soya milk is also high in estrogen as well. It depends on the seeds. You can just easily Google foods that contain estrogen and then just have a look at that. And then also just think about how you can modify the way that you live your lifestyle to just reduce that. But unfortunately, cervical polyps are common. That's what I do every Tuesday, take out cervical and endometrial polyps all day. And it's one of those things. Yeah.
Okay. So thank you for that. I think what I would ask is, I think we've had such interesting and wonderful information today, would be a list of some of the supplements and what they do. And you know, when you said that you've got that information on, was it Instagram? Is it? It's on Instagram.
No, I've got my website. I do have an Instagram page for those the lady that's pregnant. It's called Pura Mama. It's not Pure Mama. It's PURER, because the whole ethos is to try and make people purer in the way they live their lives, so that they live stronger. And then for people not pregnant, there's Pura Vita, which is only just started. I've literally only started these a few weeks ago because I realised I essentially started doing a webinar during COVID for pregnant women. So I would have 200 on a webinar trying to teach them about pregnancy and birth. And the part when it came to lifestyle, everybody just kept going on and asking me more and more. So I realised that's a real hunger for people to really understand. And then also I practice in the NHS, I do a lot of NHS, but I also do privately. And I could see the difference in outcomes in the women that stuck to the regime I could give them. So I don't have all these sort of wound infection rates. So for example, collagen is very good for wound recovery in pregnancy or any operation that anybody's choosing to do. If you've got any scars or skin, so, you know, black populations, we keloid. So what you want to do is make sure that you haven't got an overactive immune system at the point of any scar. So collagen, probiotics, the omega-3, really, really important in that part of the journey. So yeah, so if you follow us on Instagram, and then also I've got puramama.co.uk. That's primarily aimed at pregnant women, but there will be some wellness articles on there as well. But that's you can get the pregnancy collagen from there, and you can get other collagens as well, which are really, really good for health. So I've also got one that's got Moringa in it. I know some people may know about Moringa. Well, my mum calls it Sobolo in Gar, which is also really, really good it's got iron in it, magnesium, potassium. So a really good herb.
So is there a resource that you can point people to who are not pregnant, who have heard about some of these supplements, who perhaps have PCOS, hypertension, and would like to think, the
PCOS one, I think I put it up on the slide before, and it is, let me just quickly, sorry, I just have to.
And whilst you're doing that, I did try your Twitter handle, the MS Karen, and I couldn't. It didn't seem to work.
Oh, okay. So then it's Karen. So go to Karen Joash. That you should find me there.
Joash,
sorry,
okay.
Thank you.
That's fine. I just added you because I thought whilst we were talking,
I am on.
A little follow, and
so it's called She Sinks PCOS Network. You have to pay for it. But also NutriTank is really, really good because they also incorporate what foods are healthy as well.
So NutriTank, CAHN team, you taking that down so we can put it on the website. NutriTank for the different supplements, is it? Yeah,
no, NutriTank is not part of me. I'm just a member of them, but they are really good. Okay. They are very good for essentially all about diet and what you can have, and giving you medical evidence-based lifestyle talks. They do it on and off on Instagram. But if you want to follow me, I am on Pura Vita, and we will be increasingly putting more and more up there. We've also, even I think for Mother's Day, there are some freebies that you can get as well, if you go on there as well. We are also going to be, if you follow us, launching some free wellness consultations as well. But you'll need to watch out for that offer. It'll be coming up in the next few weeks. So you can share it widely among the network as well. That would be great.
Okay.
Because we're just so passionate about this. You know, I'd love to sit down with people, say, what is your issue?
I can
generate a whole lifestyle plan for them. Yeah.
Your passion comes through, and it's been such a fantastic session. I think I love hosting these sessions because I learned a lot over the
You're a fantastic host, Ngozi.
But thank you so much. Thank you so much. For everybody who's joined us today, we will list what the things on the website. Please give us some feedback, because it's really important that we are able to evaluate our sessions and also provide feedback to the people who are supporting us financially. about the reach that we're having to our Black community, and trying to get people to really own their health problems and look at lots of things that you can do preventatively, and look at improving just your general well-being. So Karen, thank you so much for today's session. It's lovely having you. And it's been great. Yeah. So I'll hand back over to the CAHN team, and thank you.
Thank you.
Thank you very much, Dr. Karen, and thank you, Dr. Ngozi, for hosting this session. It was very informative. We really appreciate your time today. Thank you so much. We're just going to call on Hilda Bertie, our Health Partnership and Policy Manager at CAHN, to give us some more information about our events coming up and what we do at CAHN. Thank you. Over to you, Hilda. Thank you.
Hi, thank you very much, Ngozi. We've got two today. I need to say thank you to both. Okay, let's start. Thanks again, both Dr. Karen and Dr. Ngozi, for again another great informative session. I think we've had a fantastic month through March with all the health hours that we've done around women's health. So I think we should, applaud ourselves for the great information that we've been receiving. I hope the women out there have really enjoyed the sessions. I'd like to also say thank you to all the attendees on Zoom, Facebook, and also on YouTube. And also, I'd like to say thank you to our partners. So we've got our BHI lead, RAFA International Development Agency, Croydon BME Forum, Enfield Caribbean Association, and RCCG Sheffield. Again, if you'd like to access anything from today's session, please go along to our Facebook page and also our YouTube channel. And you can also access the doctor's slides from today by emailing health@carn.org.uk. Also, we've talked about evaluation. It'd be really good to get your feedback. And again, you can do that for those people on YouTube and Facebook. We'd like to hear how you felt today's session went. So please complete the survey link that's been posted on the comment section. And if you're attending via Zoom, please complete the Zoom poll on your screen. There's also a link as well that we can put in the chat if you can't do it now, but you can do it later. We've got a raft of events coming up, so please bear with me while I go through them all. But the first thing I'd like to start off with is our CAHN's crowdfunding campaign. And we launched that back in the beginning of March. And we recognise that the need for counselling in the community is really, really important. And we really want your help with ensuring that we provide counselling support for our families across the communities. And we'd like to ask you to donate to our crowdfunding campaign to help us to raise around £10,000. And we want to do that, as I said before, during the month of March. Today, we have had over 350 people that we've supported since July 2020 via our therapeutic counselling service. And on average, we have between 8 and 12 sessions per person. I'd like to thank our partners at the National Emergency Trust, because any donation that you give, they will double. Again, my colleagues will put in the chat the link to that crowdfunding campaign. And again, I would urge you all to please get involved. It's a very important service that we are providing here at CAHN for communities. We've only got 4 more days to go, so please, contribute as quickly as possible. The other events that we've got is, and I'll start talking you through them, is Healthy Heart, and we do that every Tuesday between 5:30 and 7:30, and that's led by Dr. Hiba and also Dr. Alice. And then we have 30 minutes of physical activity, which is led by our physical instructor, Orlando Grant. So again, please come along to our Healthy Heart session, which is run on a Tuesdays. We've also got today another big event taking place, and that's Jamaica's 60th Diamond Jubilee anniversary of independence. And that'll be taking place at our InnoSpace Business Centre here in Manchester, Turning House, Hume, Manchester, M15 5RL. And that's between 12, so it started already, and 5 today. The keynote speaker is Mr. Wade Lynn, CBE, CD, DL, and he's Jamaican's honorary consul. If you want to know more information about this or want to register to attend, you can contact Richard Davis or Rudy Page, or there's an email address as well, rudy@makingconnections.com. Again, my colleagues will put that into the chat for you for those people that are interested. We've also got a suicide campaign taking place. If you're worried about the mental health of someone close to you, or you've got any concerns about them having suicidal thoughts, you're not alone. CAHN recognises that early suicide prevention saves lives. So again, we're here to support you. So if again, you've got anyone that you know may be experiencing suicidal thoughts, or even yourself, please contact us here at CAHN at help@cahn.org.uk, or you can call us on 077 01 022 382. And again, our professional counsellors will be ready to listen to you. Again, my colleagues will very kindly put that into the chat for you. I've already mentioned the crowdfunding and our great counselling services. It's just again another reminder that we have a great counselling service here at CAHN, which can support you around bereavement and other emotional and well-being support. So again, if you need assistance for yourself or other family members, please, please, please email us at help@cahn.org.uk, or again, call us on 077 10 022 382. And again, my colleagues have put it in the chat for you. And the service is open 7 days a week, 9 a.m. till 9 p.m. We've also got our family and advocacy.
Hilda, sorry, just before you, sorry to interrupt. It's just about the crowdfunding. I think it was just to say and just to implore people, everything we do on CAHN is there are lots of volunteers. So even if everybody who was here today, those of you watching on YouTube, those of you watching here on Zoom, those of you on Facebook, even if you all just gave £10, all the doctors we've been doing this for almost 2 years, everybody just gives up their time freely. You've all benefited from the health information that you've got. None of the doctors are paid, none of the volunteers are paid, and it's just to think to yourself, think of what it's done for you. So I really implore you to try and just put some money and support us with our crowdfunding. We want to see a real boost in these next few days. And for all the women who have benefited from the good information that we've given you, please, please, please just try and contribute to this. I felt I couldn't let that go because I've looked on the crowdfunding site. We're aiming for 10,000. We've just got under £3,000 and we've got 3 days to go. So thank you for your contribution in advance, because I know lots of you are going to click that link and contribute. We don't like asking for money. It's a bit uncomfortable, but I feel passionately about this, that we just need to support organisations like this. Thank you.
Thank you, Dr. Ngozi. Again, yeah, she's absolutely right. Please, 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 please. We cannot stress how important the crowdfunding is. And it's the first time we're doing this. We really do appreciate your support. And you do get a lot of services from CAHN. So please support it. Again, the Family Advocacy Support Service, again, it's the same information as above, health@cahn.org.uk, or please call us or text on 077 10 022 382. And not quite at the end yet, we've got a heart attack campaign taking place. And again, CAHN is delighted to be working with NHS England on this. Important heart attack symptoms awareness campaign for the Black communities. Prevention, education and engagement is key to improving our health outcomes for all of our communities. So again, we want you again to take part in this. And for more information, you can visit Health Attack Campaign CAHN. My colleagues will be very good as well for me and put that into the chat. I've got a couple more that I need to also tell you about. Core 20+5, another initiative that we're working on, looking at high blood pressure, cancer, breathing difficulties, lung problems, maternity, and any mental health related conditions such as severe depression. If you're a Black, Caribbean or African person over 18 and have got any of those conditions, would like to take part in a case study, would you like to share your story? You will get a £25 voucher. And if you're interested, please contact Peace on 077 6931 1389. And again, please can my colleagues put that in the chat, so people that are interested, you're getting a £25 voucher. And again, it's all very good causes for us to be part of. Again, if you want to know anything about all the things that I've just said to you, please get in touch with us by emailing, again, help@carn.org.uk, or contact our helpline on 077 10 022 382. You'd think I'd know the number off by heart by now, but I clearly don't. Also next week, we've got our regular weekly health hour. And next week, when we start the month of April, our guest speaker will be Dr. Joseph, and we'll be looking at prolonged stress and its link to depression. Again, we will start at 11 o'clock until about 12:15. And a future session that we've got is menopause and osteoporosis. I'm no good with medical terms, but I've done my best there. Again, thank you all for your support and your service for CAHN and the CAHN CATHIP team. Thank you for supporting this session today. Please join us, help us with the crowdfunding, and I'll hand back to Dr. Ngozi.
Well, thank you, everybody. We'll see you next week. Bye.
Are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.